If you are trying to get pregnant, girl, please go to a sickle cell specialist. If you're a man trying to start a family, please go to sickle cell program, because you're going to have to stop your hydroxyurea for a period of time, and that might make your health worse and just make you sick. So just, if you're in periods of transition, if you need extra help, if your sickle cell is getting worse, find a sickle cell specialist, please. I beg of you, not just a hematologist. Hey all, Fatima here with Thriving with Sickle Cell. Welcome back to my channel. Please like and subscribe and share. Today's topic is just going to be really short, quick, and simple. I want to talk about the difference between a hematologist and a sickle cell specialist. When you have sickle cell disease, you are classified under hematology oncology. In some hospital systems, hematology oncology is one big department, and that is for blood disorders and cancers. In other hospitals, hematology is separate from oncology, but they're kind of cousins, they're usually in the same building, near each other or whatever. But so if you have sickle cell disease or your baby has sickle cell disease, you will be seeing a hematologist, a sickle cell specialist, blood disorder doctor specialist. So they see people with like leukemia and hemophilia, other types of blood disorders, and sickle cell disease is under that umbrella of blood disorders, so you will be seeing a hematologist. So not all hematologists are created equal. As you probably know, if you've had a number of doctors, not all doctors are created equal. Some are amazing and some are interesting. Okay, so let's just put it that way. I would advise anybody who has sickle cell disease to try to find a hospital that has a sickle cell program. So this sickle cell program will be under the Department of Hematology. What I used to do and what most people do is that they just look for hematology near them. Okay, cool. That person has heard of sickle cell, they studied, maybe they've seen a patient or two with sickle cell disease, but they're not really specialized in sickle cell disease. If you seek out a specialist or a clinic that specializes in sickle cell disease specifically, that will be a complete game changer. Why? Because the nurses will be seeing mostly only sickle cell patients. The doctor will be seeing mostly only sickle cell patients. Even down to the CNAs and the nurse and the techs, they are dealing with sickle cell disease all day long. So they are a wealth of information. Also, if you go to a hematologist instead of a sickle cell specialist, these doctors see mostly cancer patients and then other blood disorders, right? They might not be very well versed in sickle cell. I've even had an ER doctor ask me how old I was when I first got sickle cell disease. I paused because I thought she meant how old I was when I found out I had sickle cell disease. So I clarified and I asked, do you mean how old was I when I found out? She's like, no, how old were you when you first got the disease? She left the room. I prayed for myself, and yeah, so we continued. As we all know, or as we hopefully, I hope you know, if you have sickle cell, that you're born with sickle cell disease. You don't just contract it at a certain age. So that kind of goes to show that not all doctors are equal, but we know that. So the issue with sickle cell clinics and sickle cell programs is that there are not that many sickle cell programs. I don't remember the number, but if you live in a major city, you should have a sickle cell program. I would advise to drive even an hour, might I say an hour and a half out of your way to find a sickle cell doctor, a doctor who sees sickle cell patients regularly, especially if you don't have a good hold on your sickle cell disease, if you are in transition with your sickle cell disease, if you're trying to get pregnant with sickle cell disease, if you are planning to travel a lot with sickle cell disease, if you are trying a new medication with sickle cell disease, I suggest to I highly suggest to find a doctor and a clinic who sees sickle cell patients regularly, or who only see sickle cell patients. This will be found at a sickle cell program. The benefit of having a doctor who is a sickle cell specialist, in addition to being a hematologist, is that this doctor is probably up on the latest science with sickle cell disease. They know what new medications are coming through the pipeline, what new medications are being studied by the FDA. They probably go to conferences with sickle cell about sickle cell disease, and they are in talks and collaboration with other doctors all around the country about the disease. So you are really getting fresh firsthand knowledge about on the disease. I used to live in Orlando, Florida, and there they did not have a sickle cell specialist, and it was interesting. So I would drive 2 hours away to Gainesville, Florida, just to see a sickle cell specialist, and they were amazing, right? They knew what fluids to give. They gave a pain plan, and they were in talks with my hematologist closer to my house. So if I had a pain crisis or I got sick or anything, those doctors in Gainesville could kind of authorize my treatment plan in Orlando. So the problem is the doctors in Orlando don't have to do what the doctors in Gainesville say to do, because every doctor can do whatever they want. They're autonomous, and they weren't even part of the same hospital system. But if the closest sickle cell specialist to you is very far away, you can kind of patch things up, talk to doctors, find a hematologist who's willing to work with a sickle cell specialist, and kind of get better care that way, because not everyone lives near a major city that has a sickle cell program. And even though Orlando is a major city, still didn't have a sickle cell program. And major cities that don't have sickle cell programs are usually major cities that don't have large Black populations. But that's not always true, though. Sometimes you have major cities with large Black populations that still don't have sickle cell programs, even though it's very prevalent within the community. So you just have to really think about these things. Also, when you think about where to work, where to live, and where to eventually settle down, this should be a huge consideration if you want to get the best healthcare possible. And if you get sick a lot, maybe if you don't get sick a lot and you just kind of get sick only once in a while, then maybe it's not a huge priority to live near a sickle cell, a city that has a big or a decent or even any sickle cell program, right? So there's the benefit of knowing new treatments, of getting new medications. Another major benefit is they just know how to treat sickle cell. So apparently there are types of fluids. There's difference in types of even something as simple as IV fluids, right? Apparently when I was in Orlando, I was just getting standard saline, whereas once I moved to this major city, once I moved to Dallas, the doctor was like shocked. She was like, "Oh no, you're not supposed to get saline. You're supposed to get this type of IV fluid." So those are things that I just wouldn't have known, right? If not for them. So take care, stay blessed, and please comment, like, share. I just want to help people with sickle cell disease feel like there's a place where we can get information, share information, and just learn from each other, because why reinvent the wheel? If you know something that can help me, I want to know it, right? I'm not too proud to beg or ask or seek advice or counsel. And if I know something, I want to share it with you, so you don't have to reinvent the wheel. You don't have to go through difficulties just to find simple answers that can greatly change your quality of life. If you know anybody that could use this video, or if you know somebody who might know someone who has sickle cell, share it with them. They might not watch it, and they might get something useful out of it. So take care, stay blessed, think healthy thoughts, and I'll see you all again soon. Take care.